This is video 2 in this series I've created for you, in which I talk about the 25 hints and tips of anatomy for learning anatomy, and I highlight a few tips from my free PDF that you can find on anatomyonthego.com. So tip number 12 from that guide is find one big hint or clue for learning a bone or muscle compartment. And so this can be a hint or clue applied to learning, for example, a direction, posterior, anterior, lateral, medial, for describing the shape of a muscle, for orientations, etc. So once you find this hint or clue or tip, once you locate it, once you identify it, then other structures just kind of naturally fall into line, or other muscles or medial lateral fall into line. So let me explain a little bit further what I mean. So let's talk about the scapula for a second. So the spine of the scapula is a perfect posterior landmark. As soon as I find the spine, which is of course highlighted by that obnoxious red circle, then you know right away that you're looking at the posterior scapula. So a structure, so the fossa immediately below the spine, the infraspinous fossa, is logically just below the spine, and then the supraspinous fossa, I know right away where that is now. It's just the fossa that's above the spine. And then I can use another landmark called the glenoid fossa as a great lateral landmark. So as soon as I find that, I know right away that I'm looking at the lateral scapula. Therefore, things like lateral border and medial border just fall right into line once I know that this is a lateral structure and once I identify that. So using the hint of lateral and using the hint of posterior, so the glenoid fossa and the spine of the scapula, that helps me orient myself really quickly for the other landmarks of the scapula. So other examples that you could use when we're talking about bones, you could use the thumb. This is always lateral. This is on the same side as the radius. You could use the pinky. This is medial. It's on the same side as the ulna. So if you're looking at a full skeleton, use these landmarks as a way to determine bones of the forearm, for example. Big toe is medial. It's on the same side as the tibia, although the tibia makes up basically the bulk of the leg. And then the little toe is lateral. It's the same side as the fibula. So you could also apply something similar to the muscles. So you can see the superficial back muscles there in this picture. You can see the trapezius, and you can also see the latissimus dorsi. So if you use the hint clue tip that the trapezius is diamond shaped, as soon as you see a big muscle that's shaped like a diamond, you know right away, okay, I'm looking at trapezius. If you use the hint that latissimus dorsi is flat and vast, and that's actually the muscle that's below the diamond-shaped muscle, the trapezius. So trapezius has the red highlights. Latissimus dorsi is below that. So latissimus dorsi is flat and vast. So you see that, you know right away that you're looking at latissimus dorsi. So again, trapezius, diamond-shaped. Latissimus dorsi inferior to that is flat and vast. Then you could also use basically a description of the shapes of the muscle. So I'll let you take a look at your old geometry textbooks to look at rhomboids, but we have muscle called rhomboid major and rhomboid minor. They're shaped like rhomboids. And so as soon as you see a muscle that's shaped like that, you know right away you're looking at rhomboid. So shape of the muscle, how it looks, how it lays on a particular bone or how it lays in a compartment is a good way to orient yourself for the muscles. So the takeaway, I'm just going to keep this really straightforward and simple for you. Find a hint, tip, clue, description to remember a particular. You can use it to remember a particular bone, muscle, nerve, blood vessel, and just keep it simple like this video. And basically my descriptions are just very straightforward and simple. Use posterior landmarks, medial landmarks, lateral landmarks. You can just describe the shape of the muscle itself. Just keep it really simple and straightforward so you can learn it quickly and efficiently. So if you want these 25 hints and tips for learning anatomy, you can find me at my website, and there it is, anatomyonthego.com. And feel free to hit me up there. And if you want the tips, I'll send it to you. Just send me your email address, and you'll receive the tips. And feel free also to connect with me otherwise if you'd like me to create particular resources for you, and I'd be happy to do so. Take care and have a good one. See ya.